What's up, you guys? This is boy Miguel giving you your daily dose of radiation, and today's video we're covering what do you do if a patient's GI button, usually it's a button on a baby, or their G2 gets replaced and you're working as an Xray tech, right? So simple protocol, usually depending on if it's the ER, usually it's in the ER because most of the time they'll come in and their stuff needs to be changed and fixed, and it'll be like on a baby or be in like on an older person. So you'll have to kind of pay attention because usually the order as a KUB. Sometimes in the notes it'll say with gastrographin. Majority of the time it will always be gastrographin. Once again, always ask the patient if they've had contrast. I mean, usually if they have those, they already have had contrast. But, just double check, make sure they don't have you don't want the patient having an allergic reaction or nothing. Same with the babies and the mamas and whoever else you're doing that for. So, usually you'll do a scout, a regular KUB, you get it, type scout, and then you get your little gastrographin, and there'll be different syringes. I mean, there's like, for an adult, usually you use the whole bottle. You'll inject it down the little tube. Usually it's like sits right here or wherever, and you'll inject contracts. You let them know, hey, this is what we're doing. These are what can happen, whatever, little simple protocol. You inject it, flush it, take the picture, and then tell them, okay, we're going to let either show the doctor right away, or sometimes they're there and they look at it like, okay, it's fine, or they're like, oh, the rad got to read it. And that's kind of about it. Sometimes, more for babies, they'll pull on their button and they're trying to see if it got out of place. Sometimes the tip will come off and you won't have like the standard thing, so you'll have to inject the contrast with a different type of syringe, not with the usual big tipped one. Certain baby, though, it's like a little Mickey Mouse one, you'll have to have an adapter or like a small little purple syringe that they have to be able to fit on the adapter to inject the stuff. So that's something to look into depending on where you work. Nighttime, that's like the most amount of fluoro we get. Well, if you consider it, it's not really fluoro, it's just contrast wise we do, and then you'll just document that you did contrast. And once again, for babies, usually you won't have to do the whole bottle. You can probably do half of the bottle and it'll be fine. And you just document like what you did. For those, the patient's just laying down and you just inject them with the thing through the little tube, and you can see like the contrast pretty well. Yeah, it's been your boy Miguel. See you on the next one.